One thing that can be really helpful to therapists when they're starting to see problem in pathological gamblers is understanding that there may be different types of problem in pathological gamblers, or even different subtypes of problem in pathological gamblers. And some of the work that I do now is to look at something called the pathways model of problem in pathological gambling. And the pathways model says that there are essentially three distinct subgroups of pathological gamblers. It was developed by Blazinski and Nauer, and I think it's a great tool for understanding how to treat different types of problem gamblers. I'm going to tell you a little bit about what we found in a recent study. First of all, the three subtypes are what we call behaviorally conditioned gamblers, emotionally vulnerable gamblers, and antisocial impulsive gamblers. The behaviorally conditioned gamblers tend to be gamblers who don't have a lot of additional psychiatric, substance use, or other sorts of additional problems, but rather got involved in gambling through basically the contingency of the gambling itself. So they might have had a big win early on in their gambling treatment career, and that big win might have led them to gamble a lot more frequently. Emotionally vulnerable gamblers, on the other hand, have more of a tendency to have a history of anxiety disorders or depression or other types of significant psychological problems, and they often tend to gamble as a way to cope with these problems. So you might think of someone who is a slot machine gambler who gambles on slot machines to help them zone out or help them not think about their problems. The third group is what we call antisocial impulsive gamblers, and these gamblers tend to have the greatest severity of problems. Not only do they also have the same sort of additional psychiatric substance use problems, but they also tend to be a lot more impulsive, so they tend to think or sort of act without thinking. I'll back up and do that one again. Antisocial impulsive gamblers tend to be more impulsive, so they tend to act without thinking. They also tend to have a history of more legal problems, and they also tend to be more likely to have a diagnosis of antisocial personality disorder in adulthood and conduct disorder in childhood. We were really interested in how these groups might differ in terms of their treatment. So originally, we thought that the antisocial impulsive gamblers wouldn't do very well in treatment. We thought that these folks might be more resistant to treatment and not do particularly well. We thought that the behaviorally conditioned gamblers might do the best, that they might fairly easily give up their gambling problems. And we thought that the emotionally vulnerable gamblers, as long as they also had treatment to deal with the co-occurring depression and anxiety, that these folks would do particularly well as well. And so what we did, we actually conducted a study where we were looking at different types of treatment: cognitive behavior therapy, referral to Gamblers Anonymous, or cognitive behavioral therapy workbook. And this study was originally conducted by Dr. Nancy Petrie at the University of Connecticut. We used those data and we combined the sample, which is 229 pathological gamblers, into three different subtype groups based on the subtypes I just mentioned to you. And what we did was we studied their gambling symptoms from the beginning of treatment, when they first started treatment, to the end of treatment after about 8 weeks, all the way out to 1 year after starting treatment, so 12-month follow-up. And basically what we found was not exactly what we had originally hypothesized. At the very beginning of treatment, those gamblers who we considered behaviorally conditioned gamblers had the lowest symptom severity as far as problem gambling. That was to be expected. The problem gamblers who were emotionally vulnerable gamblers or antisocial impulsive gamblers had much more severe problem gambling symptoms, and they were roughly similar to each other. When we followed them out to the end of treatment and out to 1 year, originally we thought that the antisocial impulsive gamblers wouldn't do very well. In fact, everybody did well. Everybody improved in terms of their problem gambling symptoms, and all three groups improved at roughly the same rate. So the behaviorally conditioned gamblers, the emotionally vulnerable gamblers, and the antisocial impulsive gamblers all improved at the same rate. That was totally not what we had originally hypothesized. What we did find, however, was that at post-treatment and at 12 months, those individuals who we considered emotionally vulnerable gamblers and antisocial impulsive gamblers still had fairly severe gambling problems. Now, you might ask, well, I thought you said that they all improved quite a lot. They did, but remember that the emotionally vulnerable gamblers and the antisocial impulsive gamblers also started with worse problem gambling in the first place. So their symptoms got a lot better, but they were still gambling problematically even at the end of treatment. So what this essentially told us was that we could look at different pathways, and what the pathways will tell us potentially is how much treatment and the magnitude of treatment and the type of treatment that problem gamblers may need. At this point, what we think is that basically emotionally vulnerable gamblers and antisocial impulsive gamblers would probably need more treatment and more intensive treatment than the behaviorally conditioned gamblers. And we need additional research to sort of tease these groups out further. But for now, what it says is, for treatment providers, you should focus on co-occurring psychiatric problems, co-occurring mental health, for treatment providers, what this means is that you should focus on co-occurring mental health problems, co-occurring drug and alcohol addiction, antisocial personality disorder, and also a person's motivations for gambling.